Think we're going to go ahead and get started. Good afternoon, everyone. My name is Roberto Gutierrez. I am the Government Relations Manager for the Oregon Department of Human Services. I use he, him pronouns. I really appreciate everyone who took the time to join us today. Today, we're just going to provide an overview of session, just some of the highlights, and give an overview of where we stand budgetarily. We'll have time for questions, Q&A towards the end of this presentation. Lisa, I'll be joined by a colleague, Lisa, who will kind of provide, will kind of just moderate that discussion a little later this afternoon. As I transition to the Deputy Director, Lisa Wint, she'll go ahead and introduce some of the key leaders of our organization and their position and begin this presentation. Thank you. Thanks for joining.
Good afternoon. Next slide, please. As Roberto said, I'm Lisa Wendt, and I'm the Deputy Director at the Oregon Department of Human Services. I use she, her pronouns. Roberto just walked through our agenda, so we'll go to the next slide and I'll introduce our leadership teams to you. We thought with some of you know our teams and some of you are new to this conversation, so we thought it would be appropriate to introduce folks. We've also had a lot of changes in leadership, so I want to make sure you know who the team is and what their responsibilities are, and then how to be in contact with them. So you've met Fairboards and I over the last many sessions. And I also want to introduce Keith Falkenberg, who is our new Chief of Staff starting in June. He served previously as a Strategic Initiatives Director, and in his current role, he's going to help us align our key initiatives and ensure programs are engaged and we're all moving in the same direction. For an agency this size, that is not a small task. And in addition, Rob Kodiri is our new Chief Financial Officer. Rob joined us in 2021 as the Deputy CFO, and then served in an interim capacity during the ledge session, and he did such a spectacular job that we made him the permanent CFO. Before joining ODHS, he directed finance, budget, and contracting for Multnomah County Department of County Human Services. Next up, Seth Lyon, brand new to us in a chief operations role, previously had been our district manager for child welfare and self-sufficiency in Clackamas County. And in his new role, he's over a number of support units, including contracts and procurement, facilities, imaging and records management, the background check unit, our publications and creative services, payment accuracy and recovery, and program integrity. So he has a large portfolio that is also shared with OHA. Next up is Audrey Miniweather-Crutch. She is our Director of Human Resources. She became the director in January 2021 and has worked for both ODHS and OHA in various roles for the last 20 years. Dion Jordan is the director of our Office of Equity and Multicultural Services. He helps lead ODHS to become more equitable, accessible, and racially just. Prior to serving as director of OEMS, he was the Equity and Inclusion Manager at Multnomah County. Last but certainly not least, Adam Vicente became the director of the Office of Tribal Affairs for ODHS in April 2019. He is our primary liaison to Oregon's 9 tribes and oversees the Indian Child Welfare Act, or ICWA program. Next slide. So next, I'm really proud to introduce our program leadership. I think many of you know, and we'll show a slide in a minute, how large our organization is, and each one of these directors in many other states would be the director of their own agency. They have that much personnel and responsibility, and we're just proud of this new team. So I want to introduce you to some of them. April Flint-Gerner was named Director of Child Welfare Division in July of 2023. She previously served as the Child Welfare Interim Director and has more than 25 years of experience and is considered an expert in many promising practices, particularly related to workforce and equity frameworks in child welfare and human services, having worked in California, Nevada, and of course now Oregon. Nikisha Knight-Coyle was named the Director of the Office of Aging and People with Disabilities in September of 2022, after serving as the division's interim director. She also has over 25 years of health and human service experience, both internationally and domestically, focused primarily in the public sphere. And prior to joining ODHS, she served as a senior advisor for equity initiatives in Oregon's Early Learning Division. Anna Lansky became the interim director of the Office of Developmental Disability Services in November 2022. Prior to this role, Anna served as ODHS deputy director since 2015 and helped to set and implement the strategic vision for Oregon's ID or intellectual developmental disability programs. She oversaw policy and Medicaid authorities and led many strategic initiatives, including the Compass Project and Service Equity. Keith Ozels was named Director of Vocational Rehabilitation in July 2019. He previously served as the VR Workforce and Youth Manager since 2015, overseeing the expansion of programs related to workforce engagement, benefits planning, the Oregon Ticket to Work program, and multiple transition programs for students with disabilities. Claire Seguin was appointed the Self-Sufficiency Program Director also in July 2023, after previously serving as the Interim Director and Deputy Director. She is also the State Refugee Coordinator for Oregon and has 30 years of experience in community development. Also, last but not least, Nathan Singer is the director of our newest program, the Oregon Eligibility Partnership, or OEP, which was formed in 2021 to support staff who determine eligibility for people applying for and receiving medical, food, cash, and childcare benefits. It also manages the One Eligibility System, which you'll hear more about later, used to process applications and deliver benefits to individuals and families in Oregon. Next slide, please. We thought it would be helpful to just give you an overview of the major programs in the agency. So on the left-hand side are the direct services. So those 6 program directors oversee that remarkable set of programs. And then the support functions that I mentioned fall under Seth Lyon in some cases, and then under Dion and Tak Gillespie, who's not with us today, but oversees the Office of Immigrant and Refugee Advancement. Ed Flick, who oversees the Office of Resilience and Emergency Management. And then as introduced to you, Audrey and Rob, who oversee Budget and Human Resources. Next slide, please. We are really proud that we launched a new website a few weeks ago. If you've ever tried to find something on our website, it's been a challenge. And we put together a pretty amazing team that was able to redesign the site to really make it easier for people who are looking for services to access them. I'm seeing some love there, so I think others are appreciating that as well. And many thanks to you and to people in the community. We had over 3,000 users who really helped us make sure it was accessible. Information's available in both English and Spanish, and we're continuing to look for ways to improve. So feel free to keep giving us your feedback. There's a link, and I believe we'll be sending the slide deck out to everyone. Next slide, please. I think many of you who've joined us before know that we are driven by our Equity North Star. We are committed to partnering with communities to develop and deliver policies that are equitable and improve community conditions. Ultimately, we want everyone to feel that they're safe, welcome, and included in our policies, our practices, and in our spaces. Many of you saw some of our focus in our agency request budget, and some of the priorities that we received through the legislative session have at the forefront of them driving towards this Equity North Star. And we know sometimes we're not getting it right in terms of making sure people can access services and feel welcome. We count on you to tell us when we're not getting it right, and we count on you to tell us when we do get it right, so that we can continue to improve and continue to create an ODHS that is truly equitable and inclusive. And with that, I'm going to turn it over to Fairboard. Thank you.
Thank you, Lisa, and good afternoon, everyone. Thank you so much for joining us this afternoon. Let's go to the next slide. We all know that 2023 has been a year of many transitions. We have a new governor. We have many new members of Oregon legislature. We had the ending of public health emergency. And as Lisa shared with you, many leadership changes within Oregon Department of Human Services. Governor Kotek was very quick and very intentional about her top priorities early on. You can see those listed on the slide: housing and homelessness, access to behavioral health care, improving customer service, accountability and oversight in state government. These are her top priorities. That does not mean that she doesn't have many other issues near and dear to her heart. And we also know that these issues don't live in silos. Homelessness has roots connected to many other challenges people face. And the governor expects us to focus on root causes, data, analysis, and outcomes. Next slide, please. You've seen this slide before, and we've come back to it many times. since this is our approach to managing the agency that serves 1 in 3 Oregonians in 3 different priority areas. The first one is basically strengthening the foundation. In other words, just doing the day-to-day work of the organization. What I mean by that is doing things like delivering services, providing benefits, keeping children and older adults safe, making sure that we're doing eligibility and helping people and find out and determine what services they're eligible for. This is the work that happens regardless. This is the reason for the existence of this agency. In the middle of this, you see preparing and responding for emergencies. And this is something that has been fairly new. Prior to 2020, we as Oregonians did not have the experience of being these wildfires, first in 2020 that uprooted 5,000 families. The heat event that we had, the ice storm, even as we are speaking today, there are fires that are burning across Oregon, and people are dealing with that. And finally, creating the future of human services, meaning as we do the work of the organization day to day, as we prepare for emergencies and are able to respond to them, if you're not paying attention to where the world is going, if you're not paying attention to what the future holds, we're going to be left behind. So we want to make sure that we are actually participating in shaping that future. Let's go to the next slide, please. So let's see here. Let me make sure I'm just... all right. So all of us know that this session was a really tough session, meaning we had basically legislative sessions for 3 years, long and short sessions that were virtual. So this was the first time in 3 years that people had come together in-person legislative session. It was a controversial session because there were a number of, you all know, there were a number of bills that were introduced by both parties, and a walkout, which threatened ending the session with no final budget, leading then would have to lead to a continuing resolution, which would not be really easy to manage for most state agencies. And then at the very final weeks of the session, everyone came together. Many of the bills that were perceived to be dead basically were resurrected. And we finally finished the session with a legislatively approved budget for 23-25. Next slide, please. In alignment with government priorities, we can see that these are some of the investments that were made during this session, making sure that people access and have access to healthcare, childcare, and other critical benefits. There was a $30 million staffing investment in Oregon Eligibility Partnership. Again, this is part of the agency that does eligibility, determines eligibility for 1.5 million Oregonians. And we are doing some internal changes to make sure that all of our eligibility staff are under one umbrella, and that is called Eligibility Partnership because it serves 3 different agencies: Oregon Health Authority, Oregon Department of Human Services, and the newly created agency, Department of Early Learning and Care. There was $16.2 million also to fund the One System. The One System is that system that allows us to do to determine eligibility for these 3 different state agencies. And when you put in a system like this, which is a comprehensive, the largest IT system in the history of Oregon, it requires maintenance as you operate the system. So that's the investment that is geared toward that. Then there's House Bill 2019, a bill that is focused on housing initiatives across several state agencies. It appropriates $12.5 million to Oregon Department of Human Services for the purpose of awarding grants to increase access by youth experiencing homelessness. And it provides those to shelter facilities, outreach facilities, culturally specific services, mental health, substance abuse services, And it also intends to strengthen partnerships for transitional housing operations. There's also about $6.2 million investment for the purpose of providing 2-year grants to organizations operating host homes projects to establish, continue, or expand operations for youth experiencing homelessness. There's also over $1.1 million for the administration of programs and services for youth experiencing homelessness. These funds are to be allocated at the beginning of this biennium, July 1, 2023. So it has already started. We also have House Bill 5506. This is the end of session omnibus bill, also known as the Christmas tree bill. It included nearly $21 million to extend food, shelter, legal services, and other wraparound services for people who are pursuing a case with the U.S. Citizenship and Immigration Services. These are people who are seeking asylum coming from the southern border. There's also a $2.5 million allocated for assistance to Afghan refugees. This bill also appropriates $6.8 million for child welfare to make permanent a 5% occupancy rate. These are for providers of behavioral rehabilitation services, also known as BRS. The funding in this bill also is in addition to the $2.9 million general fund included in the Oregon Department of Human Services budget bill, which is House Bill 5026. Next slide, please. This slide highlights other key investments in doing the day-to-day work of the agency. We have nearly $95 million in combined funding to strengthen Medicaid, home and community-based services. There's nearly $7 million in child welfare for additional child protective services. This is for the staff that do this work. This is really hard work. And it is to make sure that the agency can conduct accurate safety assessments and provide effective support to families. The end of public health emergency also ended pandemic food benefits, and it created concerns with food insecurity. So there is a $10 million investment for local food purchasing. These are food banks statewide that purchase this food and make it available to Oregonians who are experiencing food insecurity. This is intended to bridge the gap in food supplies and narrow the food insecurity gap. And funding also includes addressing caseload increases across all of our programs within Oregon Department of Human Services. Next slide, please. Other key investments in this last session will help us with strengthening our foundations and creating the future of human services. Those are highlighted in this slide and the next slide. These are general fund investments. They include $121 million toward rates for providers who deliver essential services to people with disabilities and older adults, and $9.7 million to increase rates for behavioral rehabilitation services. Providers, again, these are important providers and partners. Without them, we cannot do our work. They serve many Oregonians in need of whether children, people with disabilities, older adults. And it was really important to make sure that they get the operating funds that they need in this time of inflation to be able to manage and continue providing the services. There is $16.8 million to raise the this is an average $241 per month increase for resource families who provide children and young people in foster care. Again, that's really essential. The investments that we make are really never enough, but again, that's the best that was possible in this last session. Next slide, please. There was also key investment in helping create the future of human services. These investments can really be game changers as we talk about bringing health and human services together to create better outcomes for over 1 in 3 Oregonians that our 2 agencies serve. So expanding the Healthier Oregon program will provide healthcare coverage, supports to people with disabilities, and supports to a remaining age group, that is age group 27 to 54 years old, regardless of immigration status. We all know that technology plays such an important role in not only our own lives, but also in the future of human services. If we want to transform this system, technology plays a major and critical and central role to that. There is nearly a $3 million investment for us to be able to migrate from our current mainframe systems to a modern and supported platform. Many of these old systems date back to 1970s. This investment helped us at the very beginning stages of this transformation. It makes sure that we can begin to continue to provide access to benefits and payments as we move forward and incrementally begin to modernize these systems. The new 1115 Medicaid waiver is truly a game changer. It can be a game changer to bring health and human services and housing together. It is led by Oregon Health Authority. It brings over $1 billion into the state with innovative approaches such as food as medicine, and it is focused on social determinants of health, which is our focus also in our Building Wellbeing Together initiative. It breaks down silos, it can build bridges between systems, and the $4.5 million investment in Oregon Department of Human Services allows our agency to play a coordinating role with Oregon Health Authority around human and social services aspects of the 1115 Medicaid waiver. Next slide, please. Key policy bills in this session include Senate Bill 91 to operate a paid parent caregiver program supporting children with intellectual and developmental disabilities who have the most significant needs. House Bill 2683 ensures children involved with or at risk of being involved with child protective services qualify for the employment-related daycare subsidy. Also, House Bill 2683 expands the ERDC subsidy for homeless services, teen parent services, and domestic violence services. Then there's House Bill 3395 that allows Oregon Department of Human Services to provide financial support to nonprofit organizations providing affordable housing support to low-income college students across Oregon. And there are also some other bills, including House Bill 3409. This bill highlights a role in supporting the nitrate situation in lower Umatilla Basin groundwater management. You're all aware of the nitrate situation that we have in some eastern counties that can impact the health of the population. There's House Bill 3235. This is a child tax credit bill. It creates refundable income tax for those with qualifying dependent children under the age of 6, up to $1,200 per child. Income limit for the credit is $50,000 for those filing jointly and $30,000 if otherwise. It also, the individuals can claim up to 5 dependents. It requires ODHS to apply for a federal waiver to exclude the credit from income considerations for program qualification if you qualify for a SNAP, TANF, and some of these other programs, you can actually be exempt from that. Next slide, please. I want to introduce our Chief Financial Officer, Rob Kodiri, who's going to go through the financial aspects of this session's bills.
Thank you, Farid. Good afternoon, everyone. Thank you for being here and for your time. My name is Rob Kodiri, Chief Financial Officer for ODHS. I will be very brief, but mainly to one thing I want to draw your attention to. You see Oregon Eligibility Partnership here. It's about $801 million out of our $18.5 billion budget. These dollars are not new dollars. These are mostly reallocated dollars. from self-sufficiency and Office of Aging and Disabilities. The largest divisions by dollars, of course, you can see that the Office of Aging and People with Disabilities, ODHS, and self-sufficiency programs. But also you can see the contrast that in terms of positions, our largest position holder divisions are child welfare, OAP, Oregon Language Partnership, and of course, self-sufficiency and central and shared services. SAEC stands for state assessments and enterprise-wide costs. In terms of the total number of positions in legislatively approved budget has over 11,000 positions. Next slide, please. Briefly, for most of you probably aware, usually I'll do a brief process overview. Agency submits the budget. It's called agency requested budget, which we did last fall. And then there is a governor recommended budget that comes out. And last time it came out in February this year. And then, of course, legislatively adopted budget. This comparison compares the 2021-23 legislative approved budget and to current legislative adopted budget. So you can see that the major contributions, of course, the major changes, Faribor's listed all of them. Policy option packages made up about $115.6 million, and then the rest were some significant changes, which HCBS, FMAP, 10% rate increase, which is going to expire in March 31st of 2025, those one-time only investments. And then, of course, the bills that Faribor's listed. So I think, and you can see on the very right column here, the positions change. Majority of those positions came from two areas, were added in child safety, about 202 positions, and then over 300 positions in Oregon Eligibility Partnership. I think these are the main highlights for the budget. I'm going to pass it back to Faribor's.
Thank you, Rob. Let's go to next slide, please. What you see on this slide are basically a list of change drivers. These things, as we enter this new biennium, can really impact what happens in Oregon in human services. Naturally, with the expiring of the pandemic, the ending of the public health emergency, it's also the pandemic relief funding ended. We have seen during this really increase in funding. We've seen a decrease of food insecurity. We've seen far fewer evictions, etc. As those things were rolled back, we can begin to see some new needs emerge. Also, during the pandemic, we had the increase in Medicaid assistance percentage that brought tens of millions of dollars into Oregon every quarter. And that has ended, so that has an impact. Many of the investments that we were able to make during this session that just ended was as a result of those one-time funding. And of course, the creation of Oregon Eligibility Partnership. This is a unique, again, I talked about that. It serves 3 different agencies. It serves 1.5 million Oregonians. And it really is an opportunity for the first time in Oregon, as we talk about connecting services together, as we talk about preventing people from knocking on various doors and bringing a number of different services together with one application. This is the beginning of that vision of the future that allows services and programs to be connected so that people don't fall through the gaps of systems. To do that, you first have to be able to determine eligibility for people to create that one door, etc. This is a big deal for us in this organization. It's a major system change. It's a major culture change. So, those are some of the drivers that can impact us as we go into this next session. Before I wrap up and turn it over to Roberto for questions and answers, I wanted to share a couple of thoughts with you. I've now been the director of this organization for nearly 6 years. Human and social services can be a very fulfilling field to work in. It can also be very stressful, and I'm not talking for myself, I'm talking about the people who actually do the work. It can be a traumatizing experience to deal with people who are going through trauma and suffering. You may have heard me say in the past that the most important people in our profession are those that we serve, the 1.5 million Oregonians that are impacted by our services. And the next most important people are those who serve them, our nearly 11,000 staff and tens of thousands of staff across Oregon that work for our partners, for providers, our self-employed partners such as home care workers, personal support workers, direct support professionals. These are people who actually carry this agency on their back. The nature of our work also lends itself for our agency to regularly show up in the news and show up in the news often, and often through critical and negative lenses. You've read about us in the news, I'm sure, in the past few days, in the past few weeks, often, be it around the temp lodging challenge that we've been having. And when I talk about temp lodging, I'm talking about children in foster care and children and youth in foster care who cannot be safely taken care of in resource home or residential facilities and ultimately end up in hotels with our staff. Is not an ideal situation. Would love to get away from it. But, you know, staffing crisis, there are challenges with providers trying to hire staff. There are challenges with being able to serve youth with high acuity. And then we also have our crisis in our staffing crisis in other parts of the agency. You also may have read about our stabilization and crisis homes that serve children and adults with intellectual and developmental disabilities. These are clients, these are people, these are our friends of our children and relatives, and those that many of the people that we know that live in these homes, and they cannot be safely served in the community. This is really tough work. And again, we're dealing with that the best that we can. Emerging from 3 years of COVID, and ending of the public health emergency, remote work, inflation, staffing crisis, they all have created a perfect storm that have challenged us in many ways, and they continue to challenge us. They can easily lead to blaming the agency, blaming the management, blaming the staff who do the work. And my own experience working in public service for over 33 years has taught me that it is by coming together, looking at root causes of issues, and working together that we can resolve these issues. By doing that, we can find pathways to success. And negative news can be disheartening for those who do the work, for the frontline staff. It doesn't matter if you criticize me, it's a criticism of the agency, and it impacts the staff. It also impacts management, and it helps to put things in perspective and not lose sight that we are all working towards a common goal, and we can work together through crisis. We are going to work together to improve the agency and improve those outcomes. And the combined workforce of human services in Oregon serves numerous Oregonians on a daily basis. Great work is happening. We must be resilient. We must celebrate successes, and we must highlight the good work that the staff are doing. At the same time, not losing sight of the work that's ahead of us, the outcomes that we want to achieve, and also be accountable for it. As the head of this agency, as the person at the helm of this agency, I'm accountable to all of you. Accountability begins with me. I also want to thank many of you on this call who worked tirelessly to help us serve the most marginalized Oregonians and help us deliver on our mission. We cannot do this work without you. Last but not least, as an agency, we are committed to equity and anti-racism. Our ultimate goal is for all who live in Oregon, regardless of race, identity, age, disability, or place, to have the needed supports to achieve whole well-being for ourselves, our families, and our communities. And when we talk about whole well-being, really we are talking about those essential elements of the social determinants of health. You know, having access to healthcare, to education, to transportation, to childcare, to those basic services that all of us need in order to be able to prosper. And most importantly, connection to community, feeling of belonging. And that cannot happen unless these services are present. Our work is focused on unity and well-being of all Oregonians. This is a long journey, but I am confident that by using and focusing on our Equity North Star, we can, that will guide us. We can find a path and we'll get there, creating that anti-racist organization together. And at the same time, we cannot do it without you. So thank you for walking alongside all of us on this journey. Thank you for helping us. Thank you for guiding us. Thank you for giving us your feedback. And with that, I'll turn it over to Roberto for the next stage of this gathering.
Thank you, Fairbourse, for just kind of walking us through some of the challenges in terms of just the various services, impact to the agency, you know, from the pandemic, and just navigating the various policy changes and funding and opportunities that we've been navigating over the course of the next few years, or last few years. We have about 15 minutes just to kind of go through some Q&A, some questions and answers. I'm going to go ahead and introduce Lisa Markowski. She will kind of walk us through the question and answers. She is the comms director for the Oregon Department of Human Services. Lisa.
Hi, everyone. Thanks, Roberto. Yeah, we have several questions in the chat. And just as a reminder, if you have a question, if you want to type it into the Q&A channel there in the chat. So the first one, I'm going to kick it to Nathan Singer, who's on the line. As we mentioned, is director of the Oregon Eligibility Partnership. The question is the nearly $3 million being invested in updating the mainframe referring to the TRACS system, TRACS? If so, will it be overhauled and replaced, or will the system be updated?
Thank you for that question. Hi, everyone. Nate Singer with the Oregon Eligibility Partnership. And so the question around the investment around mainframe modernization, TRACS, which is one of our case management systems that we use in ODHS to support individuals, usually within our self-sufficiency programs and our family coaches in doing their work, is not the primary area that we're focused on related to this. This is actually around what is 1960, 1970 coded system. So we call this our mainframe. It has things such as, I'm going to use a few acronyms, I'm sorry for everyone, UCMS 512 or CEP. These are payment systems for providers or case maintenance systems that exist on these old coded black mainframe screens that we continue to utilize. And our goal intent is, while many of our financial things have to be processed through there, we need to get off of this older technology that we can't leverage further updates as we think about securities. We can't always meet all the legislative intents that many of you as advocates and individuals we serve bring up to us, because this older technology just doesn't operate in the way that people use technology today. And it can be hard to find resources to really support these ongoing. Individuals may have knowledge of the coding, but it's harder and harder to find those resources. So that's the primary focus, is building out a plan of how we can retire those systems. Programs are continuing to look at their case management systems, such as TRACS or TRACS or Oregon Access, and looking at opportunities in the future with those. But this program really is focused on those older mainframe systems.
All right, thanks, Nate. So another question, is there any change in funding for direct service contracted providers, such as nonprofits or other agencies that work with ODHS participants? And I think either Fairboards or Rob could probably take that one.
I think this is in regards to DSPs. I wonder if Anna Lansky is online. Because she could answer that question better. I believe there were some changes there.
Yeah, I think it's providers in general, which yeah.
Yeah, there are some changes, of course, and including some rate changes across the board. So I can't I mean, there are probably some contracts that have different terms, and so I wouldn't be able to say exactly for which contracts, but the general answer is yes.
Okay, great. And we can, I think we mentioned this in the chat, but we will be following up with this group with questions and answers to all those questions. So for the ones that we don't get to, or maybe ones where we can provide a little bit more detail. So we can include that one in our follow-up conversation. Let's see. Another question. This is from a benefits navigator at Rogue Community College. I would love to have embedded ODHS eligibility workers on our 3 campuses throughout the year. Any chance we can see that happen this 23-24 school year? So I don't know if Nate, do you want to take that one again?
And only because I want to be clicking the emojis along with others. I love that. Please continue to work with your local district managers in your areas about opportunities. But one of the things we will be continuing to explore within Oregon Eligibility Partnership and as we look across staff is how we can be more engaged in the community, and also looking for opportunities to engage with you all as community partners and within the community to provide resources and support so your own areas can help support individuals. We've been looking and working with many different community colleges and universities to put our Applicant portal on the computers for individuals to be able to log in and check their areas. We are just rolling out a new mobile application that individuals can also use to check and look at their correspondence. So trying to give as many tools as possible, but really love that approach. And so if you don't hear, you can reach out to myself as well, and would be glad to make the connection locally and work on what it would look like to have this type of support in the future.
Thank you, Nathan. And there's a couple questions in here about the paid parent caregiver program. Just can you elaborate on the paid parent caregiver program? And there is another one. Let's see. Will there be funding or anticipated changes for DSPs who are parent providers during COVID? I know we don't have anybody from ODDS on the line, but I'm wondering, Fairboards, if you could maybe just talk generally about this issue and what was provided by the legislature.
Yes, again, I don't have the details, but I know what the legislature provided was not what many of the parent caregivers wanting. They wanted to go back to what was provided during the pandemic, and I think what was provided was a lower level of funding. Again, that was what was granted, and as we move forward, again, we are in continuous conversation with parents, with providers, with advocates. There are going to be additional opportunities as we move forward, conversations with the legislature, etc. As we emerge from the pandemic, one of the things that I would say is that really this biennium, the 23-25 biennium, is a biennium of transition. And as we are emerging and have emerged from 3 years of pandemic into the future world that has not yet been defined, the needs are different, the resources are different, and we can create a future that did not exist before. So there are all kinds of opportunities. So I encourage our parents, our caregivers, our advocates to continue highlighting and bringing forward the needs that exist so that there will be opportunities during the short session, clearly during the next long session that comes along, because there are needs that either we are not fully aware of, we don't have a complete history and the data to be able to create a strategy about the future. And when I talk about we, I'm talking about collectively with us, with the legislature, etc.
Thank you, Fair Boers. And somebody, we do have a link to more information on Senate Bill 91, and we can follow up with more on that in the follow-up to this meeting. So we have another question. Could somebody share more about the 1115 Medicaid waiver and its implications? And I know, Fair Boers, I think you, that was also in the presentation. If you have anything else to elaborate on, that would be great.
Sure. The implication of that, again, can be major for Oregonians. For the first time, when we talk about food as medicine, it's basically providing food that is that contributes to health and well-being of that individual. It's basically using a SNAP to provide those services. It's unprecedented. It is provided for 6 months. The question is what happens after that. The same with housing. Again, when we talk about social determinants of health, we're talking about, and when we talk about well-being, we're talking about those elements of social determinants of health that needs to be connected together. Food and housing are two really major components of that. So if you are using Medicaid funding to also pay attention to the food that people are eating and a place for them, a safe place for them to live, we're now beginning to bring these services together and connect them. The challenge that's going to exist is how do we actually continue that past 6 months? I think, again, this is a major development for Oregon Health Authority, for Oregon. Again, kudos to our partners that have been able to negotiate this with Centers for Medicaid and Medicare Services. We will walk side by side with Oregon Health Authority to make sure that the health-related social services needs that impacts our people with disabilities, our older adults, in some cases, our children and families. We will get the best and highest benefit from that 1115 waiver. It's a learning opportunity for all of us. And I would say it's a pretty exciting change that's ahead of us that we can learn from and expand on.
Thanks, Fair Boers. And we have a clarifying question for the question about the contracted providers. Were the changes for nonprofits increases or decreases? And Rob, do you want to answer that one?
Yes, thank you for the question. In general, this budget, the 23-25, was a positive budget, especially because of the revenue forecast that came in late. I do want to say that although agency conducted a 15% exercise for the reduction, we did take a reduction within the agency, but those reductions should not be impacting the nonprofits. So I think in general, that should be a positive change for nonprofits. However, there are phase-ins and phase-outs for services that various nonprofits provide. And again, I wouldn't know for sure which exact specific one is phasing out or phasing in. So in general, it should be a positive change. But I can't say that everyone will see the positive change. It depends on the terms of the contract, the types of services they provide, and the longevity or length of time they were contracted to provide their services. I hope that answers that question. Thank you.
Thanks, Rob. We can take just a couple more questions off of here. We have a question. I understand the Welcome Center for the asylum seeker, the old Ramada, which is used for housing asylum seekers, is going to be closed. What happens to the 300 individuals housed there? And can you elaborate on that plan? Roberto, do you want to take that one? I think that was also mentioned in the slides as some funding from the legislature.
Yeah, no, sure. I think I could take that. I think overall the goal is to transition the individuals and families that are at the location where the agency is providing shelter. So that's kind of the primary focus of the course of the next several weeks, next few months. And like we do think that's kind of part of the directive from the legislature as we kind of manage expectations around this issue is to figure out how to continue services for the existing caseload. In terms of people receiving services. And so that's kind of probably going to be the primary focus. There's definitely other challenges and issues that we will sort of embrace in this overall conversation. But we want to ensure that the people that are receiving services have a good transition plan and are successful as they provide a more permanent, stable housing situation. Thank you, Lisa.
Thank you, Roberto. And we do have one question from somebody in the audience. I was wondering if we could unmute him. He has his hand up. And I can try, sorry. Okay, we may need to come back to that one. So let me.
I'm here.
Oh, you're here. Okay, hi, go ahead, please.
My question is, with the funding that is coming from Oregon Health and Human Services to organizations that are providing housing, has there been any thought as to making sure that these organizations that have been given this money are required to build homes for people with a disability, especially in wheelchairs, and or make sure that housing is set up for us, like ramps, bathroom setups, so on and so forth, before giving them the money?
I can at least try to answer that question. I appreciate the question. Naturally, the funding for housing comes from Oregon Housing and Community Services. Now, in cases where that funding is geared toward building homes for people with disabilities, the answer to that question is absolutely yes. In cases where you're talking about building apartment houses and there's a lot of money that's going out, it probably the most historic investment in Oregon on housing. You can see apartments going up, you can see houses, etc. In many of those cases, not necessarily. If you're just talking about a regular apartment complex, some of those amenities that support people with disabilities. For example, you can see a 5-story apartment that may not have an elevator. I mean, those things are around all over the place. But when money is allocated to actually build homes for people with disabilities, the answer is absolutely yes.
I also would like to let you know that the disability community is growing tremendously in the state of Oregon, and we need a lot of it to support that.
Thank you. Thank you for your advocacy. Thank you for partnering with us and teaching us on a daily basis with love. Aside from this forum, please send us any either ideas, concerns, or suggestions that you might have, and we will follow up on that. This is our business. This is our day-to-day work, serving people with disabilities, intellectual disabilities, developmental disabilities, physical disabilities. Thank you.
Thank you. Roberto, do you want to wrap us up? I know we're coming close to time. So like I said, we will look at the questions that we didn't get answers to or have more detail to share, and we will follow up with you all after the meeting.
No, thank you, Lisa. Thank you, everyone, for participating. Just to kind of add on to what Lisa said is we also have a finalized legislative report. We'll include that into just in terms of this overall follow-up so everyone can see that. We will also have another partner event in September as we start to communicate next steps for the 25-27 agency recommended budget process. So look forward to that over the coming weeks. And for now, thank you, everyone. Thank you for participating. And we'll see you next time. Thank you.